needed to occur, and what has occurred, is an integration where all the disciplines come together and communicate and work together and teach each other and bring resources together, intellectual and technical. And that's the newer generation of surgeons. That's the mold you want them to be out of. And that's exactly what Dr. Brooks is.
There's something about Dr. Brooks, and I could say it in probably 3 words. She has commitment, she has compassion, and she has a kindness to her patients. That she sees the patient not just for the surgery that she has to perform, but in the entire patient, the family, and if there's children involved, that makes her stand out to me as a professional who looks at women in a particularly spiritual way.
While she was at a conference, her office told, I just had a quick question, it was nothing earth-shattering. She was away at a conference. Within 20 minutes, Dr. Brooks called me back and addressed my question, which I was just blown away. Because when does that happen?
I think as a society, we become more aware of the treatment of the whole person, not just the organ that had the cancer. And as we make more scientific progress in the technical part, the new treatments, we also understand more the impact of the psyche on the healing. We know that if you minimize emotional stress, then you would heal faster, can cope with the chemotherapy or the various treatments better. And so it's practical to also pay attention to the emotional part, not just the physical part.
And even when Dr. Brooks was on vacation and she was out of the country, and I was concerned that people weren't going to get their results, she was calling in from another country to her office to make sure that she knew what the pathology results were. That if I called a patient and said, you know, Dr. Brooks is away and I don't want you to be worrying about your pathology result, did you get your result? Yes, she did, because Dr. Brooks was never really on vacation, even though she wasn't physically here. That's very impressive to me.
What she brings to the table, what she brings to the community, is the ability not only to have her technical skills as a surgeon, but her willingness and her ability to sit down and work with all of us so that she understands what other issues are going on and we understand what she has seen. And it's going to bring the best for the patient.
A lot of people, when they have been diagnosed with cancer, feel that maybe they did something wrong. Unfortunately, 1 out of 2 people will get cancer in a lifetime. And so it's not your fault. It's the fact of life. And I think we're very blessed in this community to have the cancer support group here, because everybody there is just so nice and welcoming. And it makes practicing medicine a little easier, because to have that extra support for the patients and also for the doctors.
Dr. Brooks, I think, is one of the best partners in that she understands the collaboration, all to the benefit of the patient.
Yes, she deserves this award in excellence. And I think what makes her so special is she doesn't know how fabulous she is.